And just like every week, we are back here con el señor Marcos Mejia, who always takes the time and comes over and educates us about the latest on COVID. Can you update us as to what's going on?
Of course, we continue to make progress with vaccination. We are over 1,007,000 doses that has been applied in the county. We are reaching almost 81% of the county's eligible population to be fully vaccinated. And another additional 7.2% has at least one dose. And another group, almost 64% of the eligible population, have received their booster. Our focus at this point is going to continue on promoting booster shots and pediatrics vaccinations and encouraging everyone to wear a high-quality mask when appropriate. We're recommending that people use the N95s, the KN95s also, or surgical masks. And the boosters because they provide protection against the worst outcomes of COVID, which is the severe illness, hospitalizations, and death. The odds for unvaccinated people are still far greater than the odds for people who is vaccinated. People who are unvaccinated in Sonoma County are 2.4 times as likely to be infected, 15 times more likely to be hospitalized if they get COVID, and they are 11 times more likely to die than those who are vaccinated. On the other hand, the numbers continue dropping. Our new daily cases per every 100,000 inhabitants is 15.3. When we look at this number for the unvaccinated, this is still high, 39.2 per every 100,000. And well, you see the difference when we compare with vaccinated people is 12.1% people that is getting infected. Our overall testing positivity now is 5.2%. So this number is especially important because it keeps dropping drastically. We were above 10 and now it's 5.2% of all the tests that are done. And our equity metric testing is also improving. It's only 5.8%. So that gap is getting closer between the most affected people in low-income communities versus the rest of the population. There were also the hospitalizations continue to drop. There were only 31 persons in hospitals this week, and 5 of them were in ICU beds. Also, we have reported 51 COVID-related deaths since January 1st. During January, there were 36, an additional 15 during February, to total 474 deaths. And unfortunately, residents 65 and older have accounted for 74% of those deaths, and most of them unvaccinated. The new case rates in Sonoma County show that the continued disproportionate impact on communities of colors, with cases rates for Pacific Islanders and Latinx residents double than those of white residents only over the last 60 days. We have been seeing this constant disproportions, but now the gap has widened. Vaccinations rates, especially booster shots, are lagging in those communities. Here's an example. While nearly 64% of the eligible residents in the county have received a booster, just 48% of the eligible Latinx residents have received their booster. And when we compare this number with the Asian community and the white community, they have 70% of those communities have received the booster, while 48% of Latinx have received their booster. This has been a contact since we began the vaccinations. For some reason, Latinos take a little longer to decide to vaccinate, and that's why we bring all these resources like the Roseland Clinic and many other things for these communities, or people like you and many organizations work with these communities. Let me give you some updates about testing. The county is averaging now 2,300 tests per day, down from nearly 7,000 a day during mid-January in the middle of the surge. That doesn't include at-home rapid testing that are being used. Appointments are still recommended, but more testing sites can now accommodate walk-ins. Antigen rapid testing is available throughout the county, but also in 2 new locations that the county is coordinating. The testing is confidential and it's available at no cost. No social security or citizenships are required to get your antigen test. The program is through the County Department of Health Services. And there are going to be 2 dates. It's going to be on Thursdays and Fridays. And on Thursdays is or in Cloverdale, the Grange Hall in 201 Commercial Street, over there in Cloverdale. And it's going to be open from 9:15 to 3:15 p.m. And the results can be obtained in less than an hour. And on Fridays, it's going to be in Santa Rosa at Lewis Early Learning Academy, which is located in 2230 Lomitas Avenue in Santa Rosa. That one is going to be open on Fridays from 9 a.m. to 4 p.m. And the same, no appointment is needed, and the results are in less than an hour. Now, I would like to comment about masking. As of Tuesday this week, masks are no longer required for vaccinated individuals in California, but are strongly recommended for all individuals in most indoor settings. After March 11, it's coming up, in schools and child care facilities, masks will not be required, but will be strongly recommended. Masks will still be required for everyone in high transmission settings like public transit, emergency shelters, healthcare settings, correctional facilities, homeless shelters, and long-term care facilities. As always, local jurisdictions may have additional requirements beyond the state guidance. Sonoma County will align with California on the masking and other changes. Top county health officials told the board of supervisors about this during the COVID update last Tuesday this week. Monday's announcement on masking in schools in the latest is the latest California's effort to wind down pandemic restrictions as we move into an endemic phase. This approach assumes that we will live with the virus indefinitely and relies heavily on personal accountability and risk assessment. We have mentioned that many times here, and we'll do it again today. If you have a medical condition or your health for whatever reason is weaker than normal, we recommend that you use the mask. And if you're very healthy, but you don't know if you have COVID because you didn't make a COVID test and you've been exposed to the public, or you went to a concert, or you've been around a lot of public, it's best if you do your test. And that way help us to transition to this endemic phase. It's like the same way that we live with the cold and we take precautions naturally. No one puts a fight against the cold. We all know what to do. We hope that we get to that point with COVID as well. So after 11:59 p.m. on March 11 in the schools and childcare facilities, masks will be not required, but will be strongly recommended. Okay. And lastly, I have a comment, well, about CURA. CURA is the project that is in charge of the urgent response and aid. That's what CURA means. COVID-19 urgent response and aid is the acronym. The acronym is CURA, CURA project. CURA has been there along the pandemic, and it's a crucial pandemic provider of outreach and emergency financial assistance for the county's Latinx, Indigenous, and low-income community members. I have experienced a surge of requests for emergency financial assistance this year. To date, CURA has distributed 8.5 million in assistance during the pandemic, with 7.7 million of that funding from the county. This was announced by the new director of the county's Health and Human Services, Tina Rivera. She informed this on the meeting with the Board of Supervisors this past Tuesday. CURA has nearly 800 residents on its waiting list for emergency financial assistance, with 50 more names being added each week. Cura has exhausted its funding for assistance, and the county plans to allocate another 3.8 million to this group, Cura, to help those in the waiting list and address further needs. And that concludes my report for this week.
And I appreciate that. And we just want to let people know that, again, MBOP, the North Bay Organizing Project, is working to distribute free home testing kits to families and households most impacted by COVID-19 on Saturday, March 5th of this year. This is going to happen between 9 and 11 a.m. and again from noon until 2 at their office at 1717 Yulupa Avenue in Santa Rosa. Test kits come with 2 tests per box, and they will be able to provide 5 boxes per person or per family, that is. It is important that you sign up ahead of time. You can go to my Facebook page, DACA Sonoma County, and you can fill out the form. That way, by the time you show up to the event, they will be ready and it will not take additional time. So it's important for us that you are aware of that event that is happening on Saturday. Líderes del Futuro receive also 1,900 COVID tests, and we will be doing an event in the next couple of weeks. We do not want to compete. We do not want to create more confusion. And we always appreciate the collaboration with our colleagues from MBOP anyway. So with that, I want to thank you, Senor Mejia, for taking the time and being with us. And the last thing I'll mention here is last week we talked about that on Sunday, there were hard tests that were done with kids 12 to 25 on the Santa Rosa campus of Santa Rosa Junior College by a nonprofit organization. And kids needed to be vaccinated in order to participate. And so a lot of kids couldn't participate simply because they were not vaccinated. And it is important for us to keep this in mind, because I know of at least one kid that has a heart problem. And if she had not been vaccinated, she wouldn't have been able to participate, and the family would never be able to find out. So as you're thinking to our community, as you're thinking about whether you're going to vaccinate your child or not, think about things like that, right? You are denying your child the opportunity to be healthy. We are thinking that there's going to be another event to check people's hearts in the next couple of months, probably in this area, not necessarily Sonoma County, but maybe Napa. We'll have more information for you, but that gives you maybe a couple of months for you to vaccinate your child. And with that, I want to thank you, Senor Mejia, once again, and I look forward to our next conversation.
Thank you, Rafael. We'll see you next week.
Take care.
Thank you.
Bye-bye.
Bye.